everybody, it's Dr. Jo, and today I'm going to show you some physical therapy stretches and exercises for neck pain. So let's get started. Disclaimer alert, disclaimer alert. So the first exercise slash stretch is a chin tuck, and it's my favorite. I think this is a great one because you can do it anywhere, because it really just kind of helps stretch and work these muscles in the back and in the front to relax them and get them moving a little bit. Because a lot of time with neck pain, we end up kind of getting that forward head posture, and chin tucks really just kind of help reset that. So I really like to start off with them. So a chin tuck is not tucking down like this, but it's really taking your chin and tucking it back behind you. So it's almost like if there was a wall behind you, you're trying to push your head back into it, or you're tucking that chin in. So try and keep it level. You don't want it down, you don't want it up. You want to be looking straight ahead, and you're just going to take that chin and pull in like that. So you end up getting lots of chins right there. And so you're just going to hold that for about 3 to 5 seconds and then relax. And so again, that's just kind of activating these muscles that aren't working when you're leaning forward and just getting everything moving how it's supposed to again. So I would just start off with about 5 of them. Sometimes I like using your finger as a target, so you can just place it on your chin, leave it in that spot, and then tuck back. And then again, hold it for that 3 to 5 seconds. And then a lot of times when you relax, then you can see that there's a little bit of space in between. And that just means that you're moving that neck back into place. And that's really good for that neck pain, because then that takes all that pressure off the area. So again, holding it for 3 to 5 seconds, doing that about 5 times. You can do this several times a day. So it's so easy to do if you're working, if you're just relaxing, watching TV, you can do a couple of those. So the next exercises are going to be isometric exercises. And what isometric means is you're activating the muscle, but you're not really moving the muscle. So if you have a lot of neck pain, these work great because you're not really over moving them, but you're activating those muscles to start getting some of that strengthening back in there. So what I like to do is start off with kind of a side bending movement. This is the movement you're going to do. But what you're really going to do is just put your hand on the side, so you're not making that movement. You're just pushing your head into your hand. And then same kind of thing, you're going to hold it for about 3 to 5 seconds and then relax. I like to alternate sides, because then you just give that side a little bit of a break. But again, you're trying to take your ear down to your shoulder. That's the movement. You want to keep your head and chin kind of in that neutral forward position and then go this way. But again, you're just taking that hand and blocking yourself from doing it. So you're activating these muscles, but you're not really going anywhere. And so again, a lot of times when you're really hurting, this is the best way to do it, because that quick contraction and then letting go will relax those muscles a lot. So again, 3 to 5 second holds, do 5 on each side. And then the next one is going to be a rotation isometric movement. So it's the same concept where this is the motion I'm going to be doing, but I'm preventing myself from doing it. So I'm just turning into my hand, doing it for about, that 3 to 5 seconds. Don't feel like you have to go with all your force. When you're first doing this, you might just want to do 25-30% of a push. And sometimes you'll feel a little pop in your neck, and that's just your neck self-adjusting. So that's fine. As long as it's not super painful, that's okay. But again, just kind of turning in towards your hand for about 3 to 5 seconds, and then 5 on each side. So then we're going to go into an upper trap stretch, because a lot of times these upper trap muscles get a lot of trigger points, a lot of pain in them. So getting those stretched out is a really great thing to do. So the side that I want to stretch, I'm just going to kind of sit on that hand. If you're standing so you can't sit on it, you can just make a fist and kind of push down. But what this does by sitting on it is it keeps that shoulder down, because you can stretch it without that, but then a lot of times that shoulder tends to come up with it, and you're just not going to get quite as much of a stretch as you really need. So just hand underneath your leg to keep that shoulder down. And again, your head's going to be straight forward, and you're just going to try and take that ear and stretch it over towards the shoulder, but keep your head in this position. So it's not down like this, it's not up like this. You're taking that other hand and just gently pulling over towards the other side. And you should really feel that stretch through here, a little bit back in there. You don't want it to be painful. You want it just to be slightly uncomfortable. You want to feel tension in there. And so since this is a full stretch, you're going to hold that stretch for 30 seconds and then do 3 on each side. So I like to alternate back and forth. Some people just like to do them all on one side and then switch. But I feel like if you give a little break in between, that kind of just helps reset everything. So again, head forward, up and over, and just gently pull over to the side. And you should feel a really, really good stretch through there, holding it for 30 seconds. And again, you can do these a couple times a day, just depending on how much time you have. So the last stretch is going to be a levator scapulae stretch. And this is the muscle that comes all the way up into the neck and then comes down and attaches to that scapula or that shoulder blade. And the reason this one gets so tight is because when we are stressed out or when we're working for a long time, especially on a computer, we tend to hunch up like this, and then we're overworking that muscle. So a lot of times you get a really big trigger point right back there, right where that muscle connects to that shoulder blade. So the way to stretch that out is the side you want to stretch, you're going to take your hand and just kind of put it on the back of the shoulder blade there. So you want to try and get your elbow as high as you can. You don't have to crank it up there because sometimes that might be a little uncomfortable, but you really want to try and push it up this way because that's going to hold that shoulder blade down. By bringing your elbow up, that pushes it down, so you're going to get a better stretch. So holding it like this, and then you're going to put your other hand back behind your head. And now this is the key. Sometimes people just pull straight down. You want to go at an angle, so you're going to turn your nose towards the opposite knee. That's the angle that you want to take your head and stretch it down. So it's not to the side, it's not straight down, but it's kind of in that angle right there. So I'm looking at that opposite knee and pulling downwards and then trying to get that elbow up as high as I can. And you should feel that stretch sometimes all the way up towards the neck down into that shoulder blade. And so again, since this is a stretch, you want to hold it for 30 seconds and then do 3 on each side. So then up on this side, hand behind the head, pulling down towards that opposite knee. And so that's really going to loosen up those neck muscles with the strengthening of the chin tucks, and the isometrics is really just going to get rid of that neck pain. So those were the physical therapy stretches and exercises for neck pain. I want to give a quick shout out to some people on my wall of thanks. So thank you Dan, Eric P, Tom T, and Brad H. So if you want to be on my wall of thanks, make sure and check out my Patreon page by clicking on the link up there. And don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon.